If you have a health savings account, there is a Medicare rule that could be quietly costing you money, right now, without you even knowing it. Most people with HSAs assume they can keep contributing right up until the day they enroll in Medicare. They cannot. And the penalty for getting this wrong is not a slap on the wrist. It is a tax penalty, on top of income tax, on every dollar you contributed after you were supposed to stop. And here is what makes this particularly dangerous. The trigger for this penalty is not always when you actively choose to enroll in Medicare. Sometimes it happens automatically, without you doing anything at all. Today we are covering everything HSA holders need to know before they turn 65. When you must stop contributing, what you can still use your HSA for after Medicare. The Social Security trigger most people never see coming, and the strategy for using your existing HSA balance to pay for Medicare costs tax-free for the rest of your retirement. Stay with us, because if you have an HSA, this video could save you thousands of dollars in unnecessary penalties. Welcome back to Medicare Exposed. No commissions, no plans to sell, no agenda. Just the truth about Medicare every single week. If you're new here, subscribe right now. Let's get into it. First, a quick HSA refresher. A health savings account is a tax-advantaged savings account, available to people enrolled in a high-deductible health plan. The triple tax advantage of an HSA is genuinely powerful. Contributions go in pre-tax, reducing your taxable income. The money grows tax-free inside the account, and withdrawals for qualified medical expenses come out completely tax-free. No other savings vehicle offers that triple tax benefit, which is why HSAs have become one of the most powerful retirement planning tools available for people who have access to them. In 2024, the HSA contribution limit was $4,150 for individuals and $8,300 for families, plus an additional $1,000 catch-up contribution for people age 55 and older. These are significant amounts, and many people approaching 65 are still actively contributing, planning to use that money for healthcare costs in retirement, which is exactly the right strategy, until Medicare enters the picture. Here is the core rule every HSA holder must understand. Once you are enrolled in Medicare, any part of Medicare, you cannot make new contributions to your HSA. Not Part A, not Part B, not Part D. Any Medicare enrollment stops your ability to contribute. The IRS is very clear on this. And the penalty for contributing after Medicare enrollment is significant. The excess contribution is included in your taxable income and subject to an additional 6% excise tax for every year it remains in the account. That is not a small number, on contributions of $4,000 to $8,000 per year. Now here is where it gets complicated, and this is the part most people don't see coming. Your Medicare enrollment may have already started, without you actively choosing it. Here is how. If you are receiving Social Security benefits when you turn 65, you are automatically enrolled in Medicare Part A, automatically, without filling out a form, without making a phone call, without doing anything at all. Your Medicare card arrives in the mail, and from that point forward, you cannot contribute to your HSA. Now, most people think, okay, I'll just delay Social Security, and that way I won't be automatically enrolled in Medicare, and I can keep contributing to my HSA. And that logic is correct, as far as it goes. But here is the trap inside the trap. Even if you delay Medicare enrollment, and you later enroll in Medicare Part A coverage is retroactive by up to 6 months for people who are past their full retirement age when they enroll, which means if you enroll in Medicare at 67, Medicare Part A may be backdated to when you were 66 and 6 months. And any HSA contributions you made during those retroactive months are now excess contributions, subject to that 6% penalty. This catches people completely off guard. The fix: stop HSA contributions at least 6 months before you plan to enroll in Medicare to avoid any retroactive coverage overlap. Now let's talk about what happens to your existing HSA balance, because this is actually the good news part of this video. Just because you can no longer contribute to your HSA after Medicare enrollment does not mean your existing balance disappears. Far from it. Your HSA balance stays in your account. It continues to grow tax-free, and you can continue using it for qualified medical expenses, tax-free, for the rest of your life. And here is where it gets genuinely powerful. Medicare premiums are qualified HSA expenses. Let me say that again. You can use your HSA balance to pay your Medicare Part B premium, your Medicare Part D premium, your Medicare Advantage premium, and your Medigap supplement premium, all tax-free. This is one of the most powerful retirement planning strategies available, and almost nobody uses it. Think about what this means in practice. If you spent your working years maxing out your HSA contributions and investing that money inside your HSA, you could enter retirement with $100,000, $200,000, or more in your HSA. That money can now pay your Medicare premiums, tax-free, for the rest of your retirement. At $400 per month in Medicare premiums, $100,000 in HSA funds covers over 20 years of premiums, completely tax-free. No other retirement account gives you that. What else can you use your HSA for in retirement? The list of qualified medical expenses is extensive. Medicare deductibles, covered. Medicare copays and coinsurance, covered. Dental care, covered. Vision care, covered. Hearing aids, covered. Long-term care insurance premiums, covered up to age-based limits. Prescription medications, covered. And if you are 65 or older, you can use your HSA for any expense at all, not just medical, without the 20% penalty that applies to younger account holders. You will owe ordinary income tax on non-medical withdrawals, just like a traditional IRA, but no penalty, which means after 65, your HSA essentially becomes a traditional IRA, with the bonus of tax-free withdrawals for medical expenses. It is one of the most flexible retirement accounts available. Now let's talk about the strategy for HSA holders approaching 65. Here is exactly what to do. Depending on where you are in the process, if you are still working and more than 6 months from Medicare enrollment, keep contributing to your HSA. Max it out every year. Invest the money aggressively inside the account. Every dollar you contribute now is a tax-free dollar you can use to pay Medicare premiums later. If you are within 6 months of Medicare enrollment, stop HSA contributions. Give yourself that 6-month buffer to protect against retroactive Medicare Part A coverage. This is the most commonly missed step and the most commonly penalized one. If you are already enrolled in Medicare, stop all HSA contributions immediately if you haven't already. Contact your HSA administrator and confirm that no contributions have been made since your Medicare start date. If excess contributions were made, you can withdraw them, plus any earnings on those contributions, before your tax filing deadline, to avoid or minimize the penalty. If you have a large existing HSA balance, consider using it strategically to pay Medicare premiums tax-free, rather than drawing from your IRA or 401k, which would be subject to income tax. This strategy, known as HSA coordination, can reduce your overall tax burden in retirement and extend the life of your other retirement accounts. One more important thing. If you are still working past 65 and covered by your employer's high-deductible health plan, you may be able to continue contributing to your HSA if you delay Medicare enrollment. As we covered in video 2, if your employer has 20 or more employees, you may be able to delay Medicare Part B without penalty, while remaining on your employer's plan. If you choose this route, and your employer plan is a high-deductible health plan, you can continue making HSA contributions right up until you enroll in Medicare. But remember, stop contributing at least 6 months before enrollment to avoid the retroactive coverage trap. Let's bring it all together. The key rules for HSA holders approaching Medicare. 1. Stop HSA contributions when you enroll in Medicare. 2. Stop at least 6 months before enrollment to protect against retroactive Part A coverage. 3. Do not start Social Security early if you want to continue HSA contributions, because Social Security triggers automatic Medicare Part A enrollment. 4. Your existing HSA balance remains available and can be used tax-free for Medicare premiums and qualified medical expenses. 5. After 65, your HSA functions like a traditional IRA for non-medical expenses, without the 20% penalty. 6. Consider using your HSA strategically to pay Medicare premiums tax-free, rather than drawing from taxable retirement accounts. The HSA is one of the most powerful tools in retirement planning, but it requires careful coordination with Medicare at exactly the moment most people are least prepared for it. Now you are prepared. Hit subscribe and turn on notifications, because next week we are covering the Medicare Advantage denial crisis. What is really happening behind the scenes? How insurance companies are using prior authorization to deny care to the people who need it most, and what you can do about it. You do not want to miss it. We'll see you there.